Hello, my name is Erica Leonard. I am a Master of Science in Nursing student at the University of Hartford. This presentation will delineate my evidence-based implementation project titled Changing Practice, More Frequent Sedation Assessments. The use of sedation and mechanical ventilation is a standard of practice in the intensive care unit to provide comfort and ease anxiety and agitation in the critically ill population. Sedation protocols and practices vary across institutions, warranting the need for a universal standard protocol to reduce adverse effects of inappropriate sedation. Research has indicated under sedation to have adverse effects that can lead to poor patient outcomes, such as self-extubation, ventilator dysynchrony, psychological and physical distress, and more. Adverse effects of oversedation can lead to prolonged ventilator days, prolonged intensive care unit days, increased risk of ventilator-associated pneumonia, increased mortality, and increased hospital cost. Nurses are majorly responsible for administering and titrating sedating medications to achieve optimal sedation. Poor knowledge of sedation and its management can lead to adverse effects and compromise patient outcomes. The Richmond Agitation Sedation Scale is a tool utilized to assess sedation and agitation in ICU patients that has specific criteria for sedative titration and evaluation of agitation. Literature has yet to define or set a standard for optimal frequency of RASS assessments to be performed to combat adverse effects of sedation in the critically ill population. Nurses are integral to the successful implementation and compliance of sedation guidelines within the ICU to improve patient outcomes. In the Medical Surgical Intensive Care Unit at St. Francis Hospital and Medical Center in Hartford, Connecticut, the current protocol established by the organization is to perform a RASS on chemically sedated patients every 4 hours and to perform daily lightening of sedation every 24 hours. Utilizing the RASS as a tool to optimize sedation is beneficial because it provides valuable clinical information to effectively titrate sedation. As a result of the COVID-19 pandemic, intentional oversedation was often indicated to reduce metabolic demand and improve patient compliance with medical therapy. Oversedation has become common practice, indicating an area of concern requiring evaluation. It is evident that a practice change and re-education is necessary to combat adverse effects related to inappropriate sedation. Therefore, following a spirit of inquiry and identifying an area requiring change, the following PICO question was created. Will a revision of current policy and re-education of performing the RASS assessment for ventilated patients in a critical care unit from 4-hourly to 2-hourly lead to increased scores on a post-education knowledge survey compared to pre-education? The following slides will represent evidence-based research that composes the literature review for this project. Nurses' Attitudes and Practices Related to Sedation, a national survey performed by Guttormson et al. In 2019. The purpose of this study was to explore nurses' self-reported attitudes and practices related to sedation in patients receiving mechanical ventilation. This was a quantitative research study performed by utilizing a descriptive study, where a voluntary survey containing the Nurse Sedation Practices Scale was available to active members of the American Association of Critical Care Nurses. 177 members participated in the study. Results of the study indicate that nurses agreed or strongly agreed that sedation was necessary for comfort and to reduce stress. Most nurses agree that knowledge, attitudes, and perceived workload affect sedation practices, and many indicated that they had sedated an intubated patient to complete other essential nursing tasks. Both sample size and response bias are notable limitations of this study. The study concluded that nurses' attitudes towards sedative medications and their ability to reduce distress was correlated with their intention to administer sedating medications to all mechanically ventilated patients. Evidence indicates that a lack of support from nursing staff is a barrier to sedation protocol adherence, which highlights the need to evaluate and consider nurses' attitudes when seeking to change sedation practices. Nurses' sedation practices during weaning of adults from mechanical ventilation in an intensive care unit, performed by Borkowska et al. In 2018. The purpose of this study was to determine the sedation practice of intensive care unit nurses weaning adults from mechanical ventilation. This is a quantitative study performed using a cross-sectional survey where nurses answered a voluntary questionnaire to evaluate the prevalence of and adherence to sedation protocols, use of daily interruption of sedation, and nurses' perceived barriers towards use of protocols. Results indicate a lack of sedation protocol, poor adherence to sedation orders, and inconsistent scales and frequency of sedation assessments. Barriers to sedation protocol adherence was influenced by perceived workload, pre-existing practice, organizational culture, and nurses' attitudes and knowledge. The study was limited to nurses in Belgium and further limited to those attending the 32nd Annual Congress of the Flemish Society of Critical Care, with a response rate of 66.1%. Furthermore, due to the voluntary nature of the survey, response and selection bias cannot be excluded. The researchers concluded from the themes that were identified that there is a large discrepancy between international recommendations and sedation practices. Furthermore, workload, pre-existing practice, unit culture, attitudes, and knowledge were identified as barriers to protocol compliance. Standardized sedation protocols and re-education are necessary to improve patient outcomes. Sedation practices and clinical outcomes in mechanically ventilated patients in a prospective, multi-center cohort by Aragon et al. In 2019. The purpose of this study was to explore the association between sedation status, use of sedation and antipsychotic medications, and clinical outcomes. This study is a quantitative, longitudinal, observational study that included 1,338 critically ill patients, which were followed for 18,645 ICU days in 5 ICUs at 4 public hospitals in Lima, Peru. Data collection included daily cumulative doses of sedatives, neuromuscular blockades, analgesics, and antipsychotic medications. Level of sedation was assessed utilizing varying sedation scales and translated into a RASS score. Ventilator-free days, ICU-free days, and hospital-free days were evaluated as outcomes. The results from this study indicate a 50.1% 90-day mortality among the sample. Deep sedation was the most frequent level of sedation, where the risk of mortality was 5 times higher for our patients identified as deeply sedated. Subsequently, ventilator-free days, ICU-free days, and hospital-free days were lower with deep sedation status. In conclusion, deep sedation, agitation, and benzodiazepine use were independently associated with worse clinical outcomes and higher risk of mortality. A key limitation of this study is that delirium was not assessed, as research has indicated that ICU delirium has a higher rate of mortality. Therefore, results cannot reliably indicate cause of mortality. Furthermore, a non-standard sedation scale was used among the varying facilities, whereas sedation may have ineffectively been translated from the Glasgow Coma Scale to the appropriate RASS, possibly underestimating agitation in the patient population. The researchers found more research is indicated to implement standardized strategies and protocols for sedation practices. Overall, this study identified the negative clinical outcomes of inappropriate sedation, indicating a need for continued sedation education. The effect of sedation protocol using Richmond Agitation Sedation Scale on some clinical outcomes of mechanically ventilated patients in intensive care units, a randomized clinical trial by Turan et al. In 2019. The purpose of this study was to determine the effect of a protocol using a RASS on duration of mechanical ventilation, length of stay in ICU, and outcomes of patients undergoing mechanical ventilation. This is a quantitative research study that was performed by using a single-blind clinical trial on ICU patients from January to June of 2017 in an ICU in Iran. Both groups were subject to assessments of the level of consciousness and sedation hourly with vital signs. Optimal sedation was defined as a RASS score between -1 and 1. If sedation was outside of these parameters, action was taken first with non-pharmacological measures and subsequently with pharmacological measures if the previous intervention was insufficient. The results of this study showed that the intervention group maintained appropriate RASS scores compared to the control group, indicating better sedation with a sedation protocol. The use of non-pharmacological measures was used more frequently, level of sedating drugs was limited, the mean duration of ventilator days was reduced, and the length of ICU stay was significantly lower in the intervention group. In conclusion, the use of a sedation protocol has proven to maintain better sedation scores for patients undergoing mechanical ventilation, decreased duration of mechanical ventilation, decreased ICU days, and reduced average hospital cost. Limitations of this study included a small sample size of 79 patients, and the study was limited to one ICU in Iran, reducing the power of generalizability and validity. The researchers concluded from the themes that were identified that more research was needed on the implementation of sedation protocols on clinical outcomes in mechanically ventilated patients. Furthermore, this study highlights the need for improved compliance with sedation protocols, indicating a need for continued education. Critical care nurses' knowledge of sedation and its management in mechanically ventilated patients at a tertiary care hospital in Pakistan by Masih, Daman, and Farhan in 2020. The purpose of this study was to determine critical care nurses' knowledge of sedation and its management in mechanically ventilated patients. This is a quantitative, cross-sectional descriptive study performed by utilizing a voluntary questionnaire. The results of this study indicate that most critical care nurses lacked knowledge related to sedation and its management in mechanically ventilated patients. Sedation protocols and frequency of sedation assessments should be standardized, and adequate education should be provided. The study was limited to one hospital in Pakistan, and due to the nature of this single-center study, information cannot be generalized. This study was a descriptive study, therefore findings can only be used as a baseline for further areas of research. The researchers concluded from the themes that were identified that more research was needed in multi-center studies to assess perceived barriers and practices that limit adequate sedation practices in mechanically ventilated patients. Additional research on standardized sedation protocols in ICUs can enhance effective assessment and management of sedation. Furthermore, the conclusions of this study indicate need for further staff education on sedation practices and management in mechanically ventilated ICU patients. The interventions of this evidence-based implementation project is to revise the current sedation assessment protocol from 4-hourly to 2-hourly to increase assessments and support optimal sedation in mechanically ventilated patients. Re-education will be provided to ICU nurses, supported by current evidence-based practice to highlight the essential nature of improved compliance and adherence with sedation protocols. By providing education supported by current research, an improvement in general sedation knowledge and management will be achieved. The timeframe of the EBI project was strategically picked to ensure all staff members had the opportunity to participate. Therefore, by performing project timeframes in weekly blocks, all staff members will have been introduced to the topic at least once, with ample time to seek further information in the defined areas. This procedure will be carried out for the pre-education survey, education, and post-education survey. The outcome of this project is to evaluate if revision and re-education of RAS assessments from every 4 hours to every 2 hours will lead to increased knowledge on a post-education survey. Prior to completing an in-service education, all nurses interested in participating in the study will complete a pretest to evaluate the foundational knowledge of sedation protocols and validated assessment scales for patients receiving continuous sedation. This survey will consist of 3 categories of questions. Category 1 will obtain demographic information. Category 2 will evaluate general sedation knowledge, current organization sedation protocol, and current sedation assessment scale. Category 3 will utilize a Likert 5-point scale to assess confidence in sedation management. Categories N1 and 2 will be in multiple choice format. Correct items will be given a score of 1 and incorrect items will be given a score of 0. Following completion of the pre-education survey, an in-service education will be given to all nurses voluntarily participating in the study during morning and evening safety huddles during the designated week of education. 3 weeks following the education, a post-test will be given. The post-test will be the same exact test that was given prior to the education. Scores will then be evaluated and compared to the pre-education survey through data analysis. Data analysis will be performed to evaluate progression of knowledge from pre-education survey to post-education survey. Furthermore, the Likert 5-point scale, scores will be compared to evaluate for increased confidence. Once data has been analyzed, it will be disseminated to all staff using employee emails and discussed at bi-daily safety huddles. The intent of this evidence-based implementation project is to increase sedation assessments, re-educate staff, and improve patient outcomes by improving and achieving optimal sedation in mechanically ventilated patients. Thank you.